I know that it's been a tough year for so many of us between being in and out of school, of course, COVID, the Delta variant, having to shift in gears and be able to provide teletherapy. Challenges are everywhere, but with challenges comes historical opportunity. And so today, I want to share with you my journey and how I turned my business into making six figures, working 2 days a week while implementing my second love of my life. Well, maybe my third love of my life, aside from my family, is myofunctional therapy. So I know it's Friday, and I know we're ready for it to be Friday and the weekend. I know it's lunchtime for many of you, but if you can stay with me until the end of this webinar, I hope that you can be inspired and encourage you to start your own journey. And I'm going to give you a little nugget to help you get started. So please hang tight until the end. Stick with me for a while, and we are going to start diving into the world of myofunctional therapy. What I want to do today is I want to give you an all access pass into how to implement myofunctional therapy in the digital age, right? Like in our current day and age, in this world of COVID and teletherapy. And I want to encourage you and share with you how you can do the same instantly online or in person. Now, I know so many of you are at different places in your myofunctional journey. Some of you have never heard of it, and you've maybe heard terms like myofunctional therapy, myo, orofacial myofunctional therapy, orofacial myology, and you've heard these terms, but you were never educated in them. And the good news is we're happy to help you with that. Some of you have been on a journey in OMT for a while, and you've learned from lots of different educators and mentors, but maybe you need a little help with the materials to bring it all together, to make it user-friendly. Well, we're going to help you with that too. So our goal at Simon Says is, let me tell you what our goal at Simon Says is really to make OMT for all SLPs. We want to make it accessible. We want to make it affordable, and we want to make it all inclusive. And we've done this in the past few years. We've transitioned our, so many expensive programs that are out there. And we really believe that it doesn't need to be so expensive. It doesn't need to be hard to access. It should just be right at your fingertips for a reasonable cost. I want to go back to that other page because, I think many of you are getting a lot of emails from me, and let me just do a quick introduction. You can do your own research on your own time, but my name is Jennifer Simon Triandafilo, hence the Simon Says, and everybody who knows me well calls me Jay. I graduated from the University of Wisconsin in Madison. Woo, woo, go Badgers. I'm heading back in a couple weeks with my daughter to take her on a college tour, so fingers crossed that she loves it as much as I did. I graduated from George Washington University for my master's from just a few years ago. We don't need to share my age. And then for the past 25 years, I've worked in acute care, outpatient, inpatient rehab settings. I started out working mostly with neurological disorders, patients dealing with neurological disorders for about 15 years, stroke and brain injury rehab. And then I had this wonderful opportunity to fall into this world of myofunctional therapy. I've never looked back. It's the perfect fit for me. It allows me to have that work-life balance mix that has afforded me the ability to work 2 days a week while raising my 4 kids, spending time with my family. And it's just been an absolute gift. So I started Simon Says private practice, and took a whole host of myofunctional courses along the way, ones that maybe many of you have taken, maybe many of you have heard about, including the IAOM, the AOMT. I've taken advanced Buteyko breathing courses. I've taken mastery classes with Linda D'Onofrio. Of course, I kind of jump into whatever talk tools, conferences, and classes there are. And just last year during COVID, I had the absolute treat of going to virtually a Deborah Beckman oral motor workshop, which I had been wanting to do for a while. So my most recent 5 years has been not only implementing myofunctional therapy and creating programs that you guys will hear about today, but teaching seminars to speech pathologists around the country to educate them in myofunctional disorders and myofunctional therapy. And it is the absolute pleasure of my day and my years and my profession to be able to do that, because I'm just a little bit in love with this niche area within the field of speech pathology. Okay, back to this idea of making OMT for all SLPs, making it accessible, affordable, and all-inclusive. Today, I want to share with you the top 3 reasons why you need to start implementing OMT in your caseload immediately and how easy it can be. But before I give you the first reason, I want you to look at this little boy in the picture. This is one of my clients from, oh my God, just a few years ago. This little guy is now a big guy and he's now a sophomore in high school. But at the time that he came to me, he was in 4th grade and he was brought to me by his mom because he was spitting all over his friends during lunch. They were making fun of him. Ironically, and what you'll find a lot is that he had been in speech therapy for over 2 years, working on that dreadful S sound. What nobody noticed and what everybody had failed to notice in the speech pathology side of things is that he had an underlying muscle dysfunction. He needed to correct and strengthen and place his tongue, his lips, his jaw properly before he could get stability, before he could achieve those speech sounds, before he could correct his swallow. And so in the 6 months that we worked together in conjunction with an orthodontist, we completed our myofunctional program. We worked with an orthodontist to get some dental alignment. And this kid is the picture of perfection, aside from being like the cutest, sweetest boy you could meet. In these 2 pictures, if you really delve deep, you can look at the asymmetry, a little bit of a flatter nasolabial fold on the right side. And then the post, obviously you can see the spacing in the dentition and the tongue peeking through. But then on the picture on the other side in the red shirt, you can see just harmony, you can see symmetry, and what you can't see in this picture is just good function. So again, the pictures you're going to see are my actual clients and cases. I believe that I shouldn't just be teaching the classes. I have to teach what I've done myself because all of this is evidence-based. So let's go through and let's do reason number 1 why you need to start implementing myofunctional therapy into your caseload. The first reason is because most of your caseload is affected by a myofunctional disorder, and you might just be overlooking it. Okay. Just like I told you, Tyler had spent 2 years in speech therapy working on his S sound with absolutely no progress because he had an underlying myofunctional disorder and nobody was recognizing it. Okay. These are some of the symptoms and signs that you'll see in your caseload. I'm sure some of them will look familiar to you. And something that I didn't note is that if you guys have questions during this webinar, please, please, please feel free to put them in the chat and I will be sure to answer them either via email or at the end of our talk today. And I'm happy to get back to anybody via communication in email or through Julie if you want to ask us any further questions. So again, let's get back to the signs and symptoms on our caseload. Oral habits. Number 1, how many kids do we see walk into our office that are either sucking on their thumbs, sucking on their fingers, biting their nails, sucking on shirts, sucking on their hair? We've seen it all, right? Some kids chew on their tongue, some kids chew on their lip. These are all imbalancing habits. These are all oral habits, and they affect the way that our dentition and our face grows and develops over time. Okay. Secondly, the most typical sign and symptom that you will see, and that is kind of the most well known, is the tongue thrust or the reverse swallow. And this, back in the day, when people would talk about myofunctional therapy, possibly in your grad program, they talked about somebody having a tongue thrust. In my grad program, I was a teaching assistant for our voice specialist, the wonderful late and great Dr. Joan Regnell, and she was amazing. And she, in our class, handed us a 6-page stapled pamphlet that gave us 6 weeks of exercises to remediate a tongue thrust. We never practiced it. We never got to implement it, but it was given to us. And yet we never got an evaluation tool. We never analyzed and wrote reports about it, but here was some therapy that we could implement. And that was just one sign and symptom of a myofunctional disorder. What you guys are probably hearing about now a little bit more is open mouth breathing. That's a sign and symptom. There are some wonderful books that are out there. Breathe is one of the most recent ones that we've seen come onto the market that talk about that we should be nasal breathers, not mouth breathers, and that being a mouth breather can have a negative consequence on how we grow, on how we develop, and on our health, our long-term health. So that's something that you might see and would constitute or be recognized as a red flag for a myofunctional disorder. Open mouth chewing, right? All the feeding and swallowing, that's like one symptom. all the feeding and chewing and swallowing disorders that we see in our little ones, they perpetuate, they continue until we get older. Structural abnormalities. Lots of people talk about short lingual frenums, frenectomies, ankyloglossia. We talk about enlarged tonsils and adenoids. You might hear somebody talking about a tori or torus, which is a bony growth that can occur either along the gum ridge or on the roof of the mouth. Another sign and symptom you'll see is lingual scalloping. Those are those little ridges around the sides of your tongue. Why would you see them? Because it is a pure roadmap as to where the tongue is living within the mouth. If I sit like this, I will receive and get scalloping all around that tissue of my tongue because that's where my tongue is living. It's like literally making an imprint in my tongue. Grinding and clenching and bruxing, some of these TMJ issues are signs and symptoms of an underlying myofunctional disorder. Perpetual speech sound errors, okay? Sometimes it's not just developmental and they just haven't achieved a speech sound based on their age. Sometimes it's underlying muscle dysfunction that will cause that speech sound error, and it will not get better no matter how much you drill it. Or if you remediate the speech sound, but you haven't remediated the other myofunctional issues, you're leaving that child at a disadvantage as they grow. Lastly, reports of snoring and sleep disordered breathing have had a correlation through the research into diagnoses and identification of ADHD and other learning issues. So again, we can take you through a couple of the research-based articles that are out there. There are thousands of research articles out there related to myofunctional therapy, and many of them will show the connection between speech therapy, meaning in speech therapy interventions, and myofunctional therapy. So I just wanted to highlight a couple of them today throughout our talk. So the first one is there's a doctor, he was tried, true, renowned, and really a pioneer in the pediatric sleep disordered breathing area. His name is Dr. Christian Giemnault. He passed away just a year ago, but he worked through Stanford University at the sleep medicine department there, and he is brilliant. And not only did he coin the phrase obstructive sleep apnea, but he did tons of research showing the correlation between obstructive sleep apnea and learning, between obstructive sleep apnea and improvements with myofunctional therapy. In this one article, The Critical Role of Myofascial Education in Pediatric Sleep Disordered Breathing, he notes that obstructive sleep apnea has become increasingly recognized as a notable health concern in children, given its consequences on behavior, function, and quality of life, and that the implementation of treatment modalities such as myofunctional therapy can play a role in the optimization of sleep disordered breathing. I always like to relate it to our own personal experiences. So when I had 4 daughters, when I can remember every time after I would have a baby, you're sleep deprived. You're up at night, you're breastfeeding, they're waking, they haven't slept through the night yet. And during the day, you just feel punch drunk. You just feel off your game. You don't feel like you can focus. I remember one day going to the grocery store, running into a friend, and they were like, hi, how are you? And I'm like, hey. And I was so out of it. And I realized I literally was in my slippers. Like I was so tired that I didn't even realize I hadn't even put on my shoes to go to the grocery store. I mean, how many of us can remember these little stories? Well, think about a child who is not sleeping well during the night, that they have disconnected sleep, they have wake cycles within their sleep, they're not getting a restful night's sleep. And then we send them to school each day and we ask them, expect them to perform at optimal level. There's no way. They can't take tests, they can't focus on content, they're exhausted. And we have expectations of them being exemplary in school, but really we're not looking at the fundamental problem for them. Right, you can tell I can talk about this forever. The question that some of us sometimes have is, what is the consequence if we don't treat a myofunctional disorder? And I can tell you the things that I've seen in my practice. They are things like orthodontic relapse. Right now on my caseload, I've got 2 adolescents who already went through their second phase of orthodontia. And guess what? They were not referred for myofunctional therapy right off the bat. Their tongue, their lips, their jaw have shifted things out of gear, and now they're back in another round of orthodontics. But thankfully, the orthodontist recognized it and sent them to me so that we can do myofunctional therapy and orthodontics in conjunction with one another. Other consequences include poor dental health, periodontal disease. I see it all the time, especially with mouth breathing. It can create some gum disease, malocclusion, again, related to that orthodontic relapse. If we can correct postures of the mouth early in childhood, hence the Tiny Tongue Tips program, we can alleviate and sometimes reduce the amount of orthodontic intervention they need as they get older. It's amazing. This is what we can do as speech pathologists working in the myofunctional space. Jaw joint problems, facial pain, TMJ, these are issues that I see in the older population that comes in to see me, okay? Biting, chewing, and swallowing abnormalities. You can see them from infancy in the children that can't breastfeed into adulthood in the adults who are eating soft foods and can't chew because they don't have muscular function that can support chewing harder to chew foods, okay? Excessive grinding of the teeth. Bruxing is an effort to open up that airway if somebody has trouble with their airway space. And this is the one that we see the most, the lifelong misarticulations. How many times do us as speech therapists, do we go out in the community and meet somebody with a speech sound disorder and your heart breaks, right? Because we went into this field because we want to help them. So sometimes when we see these speech sound disorders, they've had years of therapy, but nobody's addressed the underlying issue, like I talked about Tyler earlier. And of course, like I just mentioned before, snoring, sleep disordered breathing, obstructive sleep apnea, in relation to learning issues, learning disabilities, attention deficit issues, and other health risks. These are all the issues and consequences that we see in our clinics if an OMD is not treated. The list just goes on and on. If you want to, you can throw down in the chat what these pictures have in common, test your OMD knowledge. Obviously, this little cutie pie in the upper left-hand corner of my screen is a thumbsucker, that's correct. And you can see the tongue shooting out underneath the thumb, learning its pattern of pushing forward. You think that doesn't create a tongue thrust? That is one of the main reasons why somebody would have a perpetual tongue thrust. It is teaching the tongue to be low and forward in the mouth, and it is not helping it build strength to live up on the roof of the mouth, which has a whole nother host of issues when it comes to palatal development. This picture in the middle here is an anterior tongue thrust, correct? And if that tongue was put back in the mouth, and we're looking for the black hole, you would see a big open anterior bite. So yes, that person would be a perfect candidate for myofunctional therapy. And hopefully they could afford a little orthodontics to go in collaboration with it. This person over here on the left, I know you guys know this because this is something that we talk about in grad school, and that is ankylosing, tongue tie, short lingual frenum. There is research out there to help us evaluate. Now, Dr. Shahrus Zaghi out of California, God bless him, he's amazing with the Breathe Institute, has actually done research that gives us some measurement parameters, okay, using the tongue measurement range scale, ratio scale, to look at whether somebody has an anterior tongue tie or a posterior tongue tie. And those measurements can be an objective tool that you can use when you're writing your report and making your recommendations. This cute little Shih Tzu always has a tongue thrust. And over here, remember I was talking about that lingual scalloping? That is what it looks like. That tongue is just resting on the sides of her teeth. And the question becomes, is it resting there because the palate is not large enough, or is it resting there because the tongue is not strong enough to know to live up inside that upper dental arch? The picture to the upper right here, there's so many things that I could identify in this picture. I'm hoping that in the chat, you guys might be including things like open mouth breathing, low tongue resting posture. There is a diastema, a space between the two upper front teeth. And so if I was to pull back this child's upper lip, I would guess that I would see a labial tie or a labial frenum that's wrapping around his gum line, okay? Question, I have so many questions. Does this child have allergies? Do they have sinus congestion? Do they have the ability to breathe through their nose, or is there some structural reason why they cannot? Are they a thumb sucker? Do they have oral habits that is creating and teaching them to be a mouth breather? The second reason why you need to start implementing OMT in your practice immediately is because it's already in your scope of practice. And this is the most exciting part. And this is the part that I get most excited about when I teach my courses. I love when I have 30 or 40 speech therapists come to the seminars that we teach and they say, why didn't we learn about this in grad school? And I say, I don't know. Why didn't you? So our goal obviously is to get myofunctional therapy identified and recognized and accepted at the graduate level program. I'm actually going to speak at Loyola University on Monday to teach their graduate students. Thank you for inviting me for the third year in a row. But the best part about it is that no other practitioner, okay, speech pathologist, we can treat speech, we can treat swallowing, we can treat oral facial muscle function, and we can treat breathing. This is already in our scope of practice. No extra training needing other than your knowledge in myofunctional therapy, but your C's, your certificate of clinical competence, qualifies you to provide this therapy. There are other therapists, there are dental hygienists, dentists, actual just myofunctional therapists that provide myofunctional therapy, but they can't do speech. They can't do swallowing. They do work on oral facial muscle function, and I believe that they do collaborate to work on breathing. But we are the only practitioners that can do the whole shebang, okay? So this is why it's an incredible opportunity for us, whether you want to implement it and integrate it into your current practice at a school, in a clinic, in a hospital, in a private practice, or if you want to kind of do it as a side hustle, make a little extra money. But myofunctional therapy is already in our scope of practice, okay? Just get knowledge on what OMDs and OMT are, and you're ready to go. I mean, there's no way in grad school that we learned everything off the bat. We needed some practice and some training. This is no different, okay? There's research out there to support why myofunctional therapy is so imperative, is so necessary. There were two articles by Kellum and Mall, it says here, but that's actually, it's Kellum and Hale, that in two different articles that were written. And they identified that 38% of the general population in the group that they assessed presented with a myofunctional disorder. And that furthermore, 81% of children with speech articulation issues likely had an underlying myofunctional disorder. I mean, that's huge. That means of your caseload, 81% of your caseload with speech and articulation issues actually has an underlying OMD. And if we don't know how to treat it, we are not comprehensively helping our patients, our clients. And that is our goal as speech therapists. We want to help the most people as comprehensively as we can. So the research supports our need to start using OMT in our practice. Okay, what does myofunctional therapy include? This is an easy one. We can guess this based on everything that I've shared so far. Of course, we eliminate oral habits. We have really fun programs to help you eliminate oral habits. I just came from a thumb sucking party 2 nights ago where a little 6-year-old, she's probably just about to turn 7, literally stopped sucking her thumb within the first week. They had tried numerous other things, but the thumbs up program just gets it done. We had a party at her house with her friends, and the parents were drinking wine and the kids were eating cupcakes that I brought. I didn't bring the wine. I brought the cupcakes and balloons and presents and a celebration of this little girl's effort. How good she felt about herself for stopping something that was so hard in her mind to stop. And now she just needs to go right into the Tiny Tongue Tips program so that we can eliminate all the consequences that have come from that oral habit. She has a huge open anterior bite. She has such a significant tongue thrust. She has improper oral resting posture. She has speech sound errors. She has a tongue thrust swallow. She is a mouth breather. You name it, this child has it. And I can't wait to get my hands on her, right? What is myofunctional therapy? It's teaching people how to breathe properly, how to breathe nasally. So we do nasal breathing re-education, and we work together with ENTs and other professionals like allergists to figure out why somebody is not breathing through their nose. Are there, like I mentioned before, are there allergies? Are there structural issues? Are the tonsils and adenoids enlarged? Is there something that we can do about that? And we work together as a collaborative team so that we can then do some nasal breathing re-education. Okay, and we have in the Simon Says portal that I'm going to show you a whole host of breathing exercises based on the Buteyko breathing program that we have modified. We have them for tiny tongue tips, we have them for tongue tips, so that you can get started with that right away. In myofunctional therapy, we teach correct oral and resting face posture, okay? We increase and strengthen the musculature so it can support correct posture. You can't just do oral placement. You have to strengthen the musculature so that you can maintain and habituate proper placement. Myofunctional therapy includes teaching children up through adults how to properly chew and swallow correctly. And don't even get me started on the long-term consequence of somebody who has a tongue thrust. Dr. Tony Siegel out of Idaho State University did an amazing presentation at ASHA in 2016. He is my mentor. He is a god to me. And I so appreciate everything that he's taught me in relation to the long-term consequence of what happens if you do not take care of these issues when they're younger. It leads to an oral pharyngeal dysphagia and more severe oral pharyngeal dysphagia as we age, okay? Myofunctional therapy includes habituating good habits. You can't just go in and take that 6-page set of exercises that I got from Dr. Regnell, from Joan Regnell, and just teach them, okay? You can't just teach them and expect that there's going to be any carryover. No, you have to practice it over the course of time so that it's habituated and it becomes the new norm for them. And then ultimately, we want to correct speech sound errors. That's what we all went into this in the first place anyway, is because we were wondering why we couldn't remediate some of these speech sound errors that were so fussy and just hanging out. Excuse me. So we know myofunctional therapy can help prepare, strengthen the musculature to support good speech sound production when it's placed correctly. Okay, you can't just, like Tyler, you can't teach a sibilant sound if they can't maintain stabilization and mobilization in the upper dental arch. Okay, my favorite research article out there was written by Smith Peter et al. It was put into the American Association of Orthodontics in 2010. So most of your orthodontists that you work with have seen it, they recognize it, they remember it, and you're going to remind them of the fact that there was a study that looked at a control group and an experimental group. The control group just received orthodontic treatment alone, okay? 3.4 millimeters of relapse. Guys, that is like not having braces at all. So think about your $10,000, $8,000 investment that you've made, and then these 2 kids on my caseload now that have had relapse. It's incredibly frustrating for the parents, for the child. However, in their experimental group that had orthodontic appliances and the use of OMT, it was only 0.5 millimeters, which almost would be like a normal amount of relapse after somebody gets their braces off. So I take this into every meeting that I have with orthodontists, with dentists, to show them that their own group of professionals recognize that myofunctional therapy in conjunction with orthodontics can be successful. All right, reason number 3. We've talked about 2 reasons. The third reason why you need to start implementing OMT into your practice like yesterday is because I've been where you've been, okay? I've been excited and inspired to follow a path of myofunctional therapy, and I want to make a difference in my client's life for the long haul. But how? Well, this is where I feel fortunate. This is tenure. I have a 12 to 15-year learning curve of doing this, and it can become your superpower. I want to arm you with everything that you need to be successful in this space. So what does that mean? Well, what it means is that Simon Says we've spent the past 7 years creating a novel approach to implementing OMT with customized programs and an online integration portal. So the reason that we've done this is I had my initial education, I learned what myofunctional disorders look like, but I was sitting in a room with dental hygiene providers and dentists and orthodontists and craniosacral specialists. And so while the classes were teaching therapeutic interventions that could work for all of our professionals, I felt that it was missing something from a speech pathology piece. I felt like it was missing this hierarchical, very directly targeted speech need. And so I came back and I spent a lot of years creating the Simon Says programs that are based off of everything that I learned, but I think follow a more methodical, hierarchical, and speech pathology targeted focus for myofunctional disorders and myofunctional therapy. And then luckily, like a year before COVID hit, we had created this unbelievable online integration portal just in time for COVID to hit and people needing to provide teletherapy. So it's like the therapy programs were already created. We converted them into a digital portal, and now you guys can use it in any fashion that you seek, whether it's in person or online. So the past few years, we wanted to see if we could make OMT affordable, accessible, and all-inclusive. It worked. And I want to take a minute to ask you a question, okay? I want to know if I can take you through a little journey into our portal. I want to show you the portal, show you what we created, show you how you can use it to implement in your therapy like tomorrow or yesterday, depending on what your OMT knowledge is. So I hope that you are comfortable taking a few minutes to go through this with me. All right, let's do the Simon Says All Access Pass. Let's get into it and jump right in. I'm hoping that this works where it takes me right to my portal. Yes, it does. It's amazing. Okay, and my internet's slowly working. All right, great. So our online portal is super wicked awesome. And I'm sorry for all the videos that you have to watch of me. I get tired listening to myself, but there's some in the portal. I just want to take you through the highlights. There's a welcome video basically saying, welcome to Simon Says. We're so glad that you're here. Opportunities to sign up for our seminars. And then ironically, right before COVID hit, we had recorded one of my live classes here in Maryland, and we were able to take and convert that class into an online seminar. So there are opportunities for online training in all of our programs, and that's right here in the portal. So again, you would click on it and there's all these modalities or modules, I should say, that you can go through and learn about anatomy and physiology. And there's an orthodontic presentation. We do anatomy and physiology. We do assessment. We do the history. You learn about the history of myofunctional therapy. It's quite extensive. Then you can see off here to my right, last year we had a Simon Says Symposium. We brought some of the greatest providers in the field of myofunctional therapy, whether they be chiropractors, ENTs, orthodontists, pediatric dentists. You know, my total mentor, and like, this is how I feel about Char Beauchart. So I bow down to Char Beauchart, and she provided a talk for us. There's Tony Siegel. We did some feeding experts. So the symposium was a way that we provided our community members with the ability to get CEUs. Oh, I think our community could join it, not just our community, but anybody in the community could purchase just the symposium and get 15 CEUs to learn from people in the field. Okay, what I want to take you through is our Tongue Tips program. So Tongue Tips is our quintessential myofunctional program. And if you click into it, you'll see that this is basically like, you know, those workbooks that we keep on our shelves and we pull out our workbook. This is basically the workbook, okay? So it's welcome. The program is designed to retrain the musculature of the face and the tongue for proper posture within the mouth, okay? We're correcting swallowing and speech. We're correcting breathing. And in this program, if you click on it, it actually takes you to our workbook. What we did that was different from anything that I had seen was we created little icons, because I think it's really important for clients to know why they're working on what they're working on, not just some random exercise that they're being introduced to, but look, these are the tongue exercises for this week or this session. These are the swallowing exercises that we're going to work on. These are exercises to work out the lips and get them to be calm and quiet and meeting together so we can nasally breathe. These are our speech exercises, posture and breathing. So on each session, there are a list of exercises for strengthening, exercise always for resting posture, speech and breathing in every session. Now, again, mind you, not every patient presents with the same issues. So what if somebody walks in and they're already a nasal breather and they only have a speech sound disorder or speech sound error and a tongue thrust. Great, terrific. You modify the program. It's like a cookbook. Okay, you can modify and tweak it as to how you deem necessary as a therapist. I mean, that is what we do as therapists. This is not cookie cutter, although it provides you with the template if you want it to be. Sometimes, when I first created Thumbs Up, I would sit in my car before I would go in to see a patient, and I'd rehearse my script of everything that I would say. Now I can literally do it in my sleep. But if you feel like you need to use that script, we have them in here so that you don't have to spend too much time overthinking it, stressing yourself out, and getting anxious about it. Okay, so the program is there. We list out our pre and post frenectomy exercises. I'm just going to show you that document. Yep. We have exercise sheets. So if you did want to break it down, like somebody called the other day from our inner circle and said, I need to do the pre and post frenectomy exercises, but I don't see an explanation of them. And I said, Wendy, don't even worry about it. Go into your portal, go under tongue exercises, print out your tongue exercises, and just circle the ones that are on the pre and post surgical list. And that way they have an explanation. So if you need it, I can pretty much guarantee you that we've thought of it. And it's in here. We have flashcards. My favorite one that I've been using, we have a placemat. If you want to laminate this and let the kids use it while they eat snack in your office, because we eat snacks at all of our sessions, it gives them reminders of the STARS method and how to properly eat and swallow. I use this all the time as they get higher level and they're really maximizing their swallows. I have them use a chart to check off every correct swallow for one meal a day. Then we get a percentage, like, okay, 50% of my swallows are good. Okay, so again, it's all in the portal. This is my favorite. This is the tongue exercise hierarchy. If you want to know what a fundamental skill is and how you can build, this hierarchy will show you how they get harder and harder. Tongue tip is just lifting the tongue up, but tongue water trap is actually suctioning your tongue up and holding liquid on there until you can bite your teeth together and swallow. We don't just have the programs, but we have the evaluations. We have sample reports. I created an evaluation, so I've got my eval. Marcason is a very well-known provider in Brazil, and she created an interdisciplinary oral facial examination tool. I love this because it has visuals. So I have her permission to put this in our portal as well. There's even a reference of how and where you can find your materials. You can find them online, or you can order them through companies that we have ordered from before. All right, so that's tongue tips. Let me get to, I didn't even show you the most exciting part. We've spent time creating videos, so that's the biggest complaint that people had, is that they would leave a seminar or they would leave a session and be like, I don't remember how to do tongue tip. Well, look, this is the best part. We have videos. If I play my niece Rachel doing tongue tip.
Take the tip of your tongue up to the ridge behind your teeth. You'll lower your tongue and lift it back up 4 times.
Okay. Or here's Waggle Spot.
The next exercise is called Waggle's Spot. You're going to wag your tongue from side to side and then lift it up to the spot on the ridge. You will repeat this 6 times.
So the coolest part about what we created in the portal is that we created the ability for you as a clinician, while you are providing therapy either in person or via teletherapy, I've done this both ways, is to click at the bottom. It takes you to our private YouTube page. You cut and paste it into an email to that client. And then in their email, they get all the videos at home. So that way, nobody can ever come in the next week and say, I couldn't remember my exercises, because you've sent it to them. Way back in the day, before I ever we created these videos together, it would be like, I would be recording myself in the session and then I would send it to the patient. And I'm like, why am I doing this 500 times a day? So the videos give us the ability to just, for every session that you have, you'll have exercise videos. We even created breathing exercise videos, I told you. Those ones you have to do individually. You have to copy the link individually, because you're never teaching all of them in one shot. You're week by week choosing one different breathing exercise. My daughter Izzy doesn't look too happy there, but I promise she does an amazing job. That's so funny. Okay, so let me get to Thumbs Up. Thumbs Up is our oral habit elimination program. Again, in the portal, you can find all the tools you need to implement the program, the parent information. We even created a video, a little Powtoon video to teach kids. It's important for them to understand, why do I need to stop sucking my thumb? Why do I need to stop biting my nails? So we have a little superhero.
Hi, I'm Thumbs Up. And I want to help you stop your sucking habit.
Okay, so we use that video as an educational piece of our initial session with them to help them stop. And once they understand it, when you know better, you do better, it makes it much easier. But we've created more than that. We have comic books that we made to help kids understand why they need to stop their oral habits. We have a game that we created, okay? And you can order the game, and I usually play that at my 1 week check-in. We give you a script. Remember I told you how I used to sit in the car and I would recite what I wanted to say? Well, we wrote it out for you. There's a video of me doing a thumb session. There's a script checklist to make sure that you have everything you need. So again, I'm trying to take the thinking out for you guys. I came home from my classes and said, oh my God, how am I going to do this? I just wanted to streamline it. We wanted to make it easy so you could just walk out of the seminar, walk out of these online classes, stay within the portal and just implement the therapy the next day, aside from ordering a few things that you might need in your office. Okay, and then a few years ago at Simon Says, we had a team that created the most amazing and the only early intervention myofunctional program. This program is 250 pages long, so just be ready. But I am going to take you just to show you our weekly workshop. I order these in pads, and in every session you will do warm-up time, mouth time, breathing time, talking time, sip and snack time, and that correlates to the program. So in our 250-page pamphlet or workbook, you will see that the program follows warm-up time, mouth time, breathing time, talking time, sip and snack time. And we have songs, whether it's Mr. Mouth. Mr. Mouth is here today. Hello, so-and-so, it's time to play. He has 2 lips so he can kiss and a tongue so he can lick. Mr. Mouth has lots of teeth. Open wide, it's time to eat. And then we play games where Mr. Mouth will kiss or bite or lick the group, somebody on their knee, on their arm. So there's so many fun things you can do. We have activities that you can play. This is my nephew and my niece and my daughter. And we've made activities and pictures for all of the exercises and all of the activities. In addition, you can use these flashcards. We made flashcards that you can print out and laminate. There's Brody Boy, and he's doing Smile Big. Here's Devin, my daughter, doing Hello Head Bobs, a breathing exercise. Here's the 3 kids blowing bubbles. Here's Sweet Bella, she's doing a cheek roll. So again, you can print these flashcards out, laminate them. I play games, whether you use a popper, any game that you can think of, Pop the Pig, you can use these materials to literally have a therapy session done. Again, we have evaluation tools. So we have an evaluation, which is based on tongue tips. We have a speech sound screener. I'm sure you guys all have tools that you use as well. We have how to conduct a session. So we have some sample videos of how to do a session. We have a resource of how to get materials. We have breathing exercises that we have done with a younger client. And then at the bottom of the portal, we are about more than just the therapy itself. Our goal is to help you build your business. So again, like I said, whether you are in a school and you want to start using this with your school-aged children and knowing the boundary between what you can and can't do within your county, whether you are somebody who works for a private practice and maybe you want to get your seminar paid for by the owner of the company and you want to be the OMT clinician who provides that in that practice, we've got everything for you ready to go. But one thing that we have is these marketing materials. We have these wonderful brochures that we've created. We spent a lot of time making them, and we want to give them to you. All you need to do is follow Julie's video where she tells you how you can order these on Vistaprint or Office Depot or FedEx or wherever you'd like to order your paper materials from. And you can even modify this. Like on my pamphlet, I have my picture on the back and then my bio. But we made this generic one so that you guys could use that as well. But we have these pamphlets for, this is Tiny Tongue Tips. Oops, that's actually not correct. Oh, there, because I'm in the wrong spot. This is the Tiny Tongue Tips little insert, and you can insert that right into a tongue tips one. Again, everything is kind of easy. Okay, it's just kind of saying, does your child have a potential myofunctional disorder such as mouth breathing, a protruding tongue, misplaced teeth due to an oral habit? If so, then the Simon Says Tiny Tongue Tips program could be right for you. And it's a play-based program teaching proper oral postures. Oopsie. Oh, I just went off of my portal, but let me show you how easy it is to get back in. I keep my portal right here. Yeah, now it's gone. So I keep my portal up on my dashboard and it logs me right in. So here I am again. At the top, you can see that we have weekly office hours. We have ability to meet with the team. We have support meetings. We have Tiny Tongue Tips office hours once a month. So again, it's more than just therapy. We want to be there for you as not only clinically and professionally, but also personally. We want to help you build a private practice if that's what you want to do. We have these amazing resources that we had one of our awesome clinicians, Claudia Davidson, create, where it tells you step by step what's your pathway to a private practice, okay? Pros, cons, and how to do it, okay? And she gives you exactly step by step what to do. Setting up a Google My Business. Does it have a website? How do you generate a super bill? We have resources. I have interviews with other professionals. Every week in our office hours, we share those, okay? So enough about the portal, but okay, everybody, now I want to talk to you a little bit about what Simon Says can do for you. We know that all of you SLPs are in a different position and place in your career and in your life. Some of you might be just starting your families. Some of you might have your families established and you're in the rat race of daily life with them. Some of you might be empty nesters and you're looking for something new and nuanced to do in your career. The best part is no matter what place you are in your career and your life, our goal at Simon Says is to make it easier for you. We want to make it easier for you to get started in the myofunctional world and on your journey. And we also want to make it easier for you as you're executing your therapy and building your practices clinically. And so we offer a lot of different ways that you can get trained and utilize our information. If you want to just dip your toe in the water and get a little myofunctional information and see if this is an area that you want to pursue, then you can take advantage of our individual courses. These individual courses, you can purchase one and just have an introductory course into myofunctional disorders and myofunctional therapy and learn about how to assess your patients that might have myofunctional issues. You might want to take an individual course on tongue tips, which is our quintessential myofunctional program. If you work with the littles, you might want to find that perfect early intervention program to use your myofunctional knowledge with, and that would be Tiny Tongue Tips. And some people just want to do their thumb sucking program. And for those, they might take our individual course of Thumbs Up to learn a great way to implement and get success with your thumb sucking and oral habit clients. Any of these courses can be purchased individually for a single price, or you might choose to bundle them all together. And we have a course bundle, which allows you to take all 4 courses and gives you this certification in our programs. So whether you're looking for just a little bit or a lot, we have that for you. Some people have already had some initial education, or they want to have that interaction face-to-face or online with us. So while the individual courses and the course bundle are self-study courses that you can do online, if you want to get a little piece of us in person, you might think that you want to join our hybrid course. This is a course where you meet live for 4 weeks in a row on the night of our choosing. It might be a Monday night or a Tuesday night for 4 weeks in a row. And it's 12.5 hours total. So 8 of those hours are live online with me on one end and you on the other. And we take you through our course, similar to the knowledge base that you would gain from the self-study courses that we offer. And then 4.5 hours you're doing on your own. Okay, so you will have homework and assignments to complete for the following week. I have to give credit to Nina A. Johansson. Her Food Smart Kids course was organized in this fashion. I fell in love with it during COVID and knew that we needed to modify assignments as course to be modeled the same way. I love that if you don't want to self-pace the total course and you don't want to come live with us to our conference, that this is a nice way over the course of a month to get some myofunctional knowledge. We usually have a professional join us online, and maybe you can bring some questions to us, ask us about your own personal professional journey in your clinic and the area that you're working in around the country. And we're happy to work with you and walk you through those steps over the course of a month. And I think that everybody really appreciates when they're in that hybrid course that your cohort, your online course community are giving you support throughout the course and then after you leave as well. So maybe that live online hybrid course is an option for you. And we usually offer that around the March timeframe. Some people want to come join us in person, and we love, love, love getting prepared for and executing our annual live conference. This is where we do an intense 3-day myofunctional certification. You come to us here in Maryland, usually, although we have moved around the country, and we will give you the knowledge that we have want to share with you about myofunctional disorders, myofunctional therapy, about our programs that we offer so you can get certification in them. We always engage in a hands-on workshop so that you can practice these exercises and these programs, share ideas with each other, and build on your practical clinical skills. The best part about it is there's nothing more fun for me than to sit in a room with a bunch of knowledgeable, amazing, incredible speech pathologists and share ideas. So usually our providers will come, and some of them might already be practicing in the myo world. Some of them have never even touched it. So we all share, therapy ideas, different programs and that we've used in the past, what we find that we like about them or don't like. And I love sharing this knowledge. I don't have to be the expert in the room. I love sharing ideas and learning from you guys as well as you learn from me. Another part of the live conference that's super, super fun is that we have networking opportunities. So we always, because if you know anything about me, I am all about collaborative care, about interdisciplinary programming and building up relationships with people and professionals in your community that you can work together with. I mean, just this morning, I went to go meet a client at a physical therapist's office, somebody that I have a very good relationship with who treats a lot of my patients in body work when they're preparing for a frenectomy. So I want to help you guys create those opportunities where you can network with providers in your area. And so we have professionals come in, orthodontists, dentists, physical therapists, occupational therapists, oral surgeons. Every year is different who's available and who will come join us. And they share their area of expertise and also can give you little nuggets of information and how they best like to be approached by speech pathologists that come in to work with them. So I think it's important to know not only what we can offer them, but how they like to gain and build relationships with us too. Another thing that you should know about the content in our live conference is that we always cover myofunctional disorders, myofunctional therapy. We do assessment, we do history, we do anatomy and physiology, and of course we go through our 3 quintessential programs so that you can literally walk out of that conference and start practicing your therapy the next day using our portal, or even just to execute what you've learned over the 3 days. And then some members in our community, they not only have attended all of these educational courses, but once a year we create something special. We have something called our Myohax Symposium, and we compile and we collaborate and we ask professionals within the myofunctional world. And usually they're either authors, writers, speech therapists, breathing experts, feeding specialists, physical therapists, occupational therapists, dentists, orthodontists, airway specialists, sleep specialists. It's varied so much throughout the years that we've done this. And we ask them to come and speak about their area of expertise. So you might get tired listening to me talk all the time about what I'm passionate about, but now you get the opportunity to learn from other people who are experts in this, in their domain as well. And we really started this in COVID because we felt like we still wanted to educate and stay in touch with our community, but everybody was dispersed all around the country, staying safe, and a way that we could still keep up that relationship and still educate you and keep you in touch with what was ever changing in the myofunctional world was to create this symposium. And it has been a huge, huge success. So I'm super grateful to all our providers that have joined us for that through the years. So that is usually offered like around the May time, but it changes from year to year. So that leads us to another opportunity we have, which is our annual membership. It is available with the purchase of any course. So whether you've taken an individual course, just one of them, or whether you've purchased a bundle, or whether you've joined us for the hybrid, or whether you come to our live conference, you have the opportunity to pay a little extra money for an annual membership. And what does that annual membership get you? A lot. So it gets you full access to our programs. It gives you full access to all of the supplemental materials we've created. And I can't even go through all of it for you because there's too much to name, but it includes comic books and educational videos and scripts of what I say when I go in and work with my thumbs up clients. It'll give you interdisciplinary communication forms so you can bring these in when you do your lunch and learns. And speaking of lunch and learns, we have ready to present, already created presentations that you can walk in the door to present to your providers that are going to want to learn more about what you do. At our last live conference, while we were sitting together, one of our speech pathologists got an invitation to do a lunch and learn with her local pediatric dentist who had heard about her 2 days after she finished the conference. So she was freaking out, but then we showed her that the lunch and learn was ready to roll. So we practiced it together as a group. And because it was local, I was even able to go with her to do it with her. And she nailed it. She crushed it. I mean, she's going to have to leave the school system like next week because she's going to be so inundated with referrals. But again, whether it's business development, whether it's the research articles that you want to use, the evidence-based practice that you want to share with your professionals, Myo minutes from our clinical office hours, our teletherapy resources, you name it, and we have it all ready for you in the annual membership. Okay. So the question that we always like to ask is, if all of this access did was certify you in myofunctional therapy and allow you to implement it into your current practice, or for some people that are interested to start their own practice, would this be worth it? If all of the Simon Says access did was to give you tools so that you could create those interdisciplinary relationships and team for referrals, would that be worth it? If the access to the Simon Says portal and membership gave you access to our community, to the constant support and connection that you will make with these amazing speech therapists all around the country, would that be worth the investment? And lastly, if we gave you access to this amazing Simon Says portal, which is an online workbook to grab off your shelf and use at a moment's notice with your clients to provide teletherapy or in person, would that be worth it? And I hope the answer to your questions for all of these is a resounding yes. And the truth is, I don't want you to take it just from me. I want you to look at these testimonials and read what other speech pathologists around the country say. We are so grateful for having had a lot of years under our belt of working with amazing speech therapists, some who are just looking to expand and get a little extra money on the side, a side hustle, some who actually started and grew their own private practice just from working with us, others that are working in the school system and know that there's an underlying issue for so many of their clients that they need to make a difference with, and this is how they can do it. And guys, it's not just about the speech therapists. It's really about our clients. It's how we want to make a difference one client at a time. These are the before and after pictures. These are the changes that we're making. This is why we're speech therapists in the first place. This is why we do what we do. So I hope that you will think about it. If you have questions, reach out, ask us at www.simonsaysspeech.com or use the button below to sign up. And we hope that you join us in some way, shape, form, because we are happy to be here for you and we love what we do. And we know that you will love this world of myofunctional therapy. So take care. Thanks for joining me today. And we hope to see you soon.